Hello and welcome, dear learners, to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 3, Patient Safety Management, Infection Control and Medication Safety, the Chapter 34 deals with Medication Safety, Part 4. It deals with monitoring medication error harm stratification. So, what is monitoring? So, after administering the medicine, monitoring the patient is very important. It serves two processes: helping in evaluating whether the medicine is producing the desired effects, helping in identifying the delays as well as immediate ADRs, that is adverse drug reactions. So you need to see in monitoring evaluation whether the medicine is producing desired effects or whether it is identifying that the delay as well as immediate ADRs to it. So monitoring errors result from failure to review add a prescribed regimen for appropriateness and detection of the problems, or in addition failure to use appropriate clinical or laboratory data for the adequate assessment of patient response to the prescribed therapy. So monitoring is very important, and it has these two purposes which are very important to be seen by every healthcare workers. Here is a case study with related to medication induced fall. A 55-year-old female who is admitted for hypertension is injected with furosemide. What happened to that patient is that she developed a postural hypertension, and which led her that she had a fall while getting from the bed. So this was being encountered and has been detected because there was a heavy workload with the healthcare workers, and even encountered to be seen as inadequate monitoring as one among the very important cause. So monitoring was being seen as a very important reason actually which contributed for the patient to have a postural hypertension. What is the summary of this case study? That is furosemide induced postural hypotension which lead to a fall to the patient compounded by lack of monitoring. So you may see multiple such cases to a patient actually which are more because of inadequate monitoring. Reporting and detecting the medication error. When you come across any medication error, how you need to work on reporting and detecting it, we will see it over here. Often there is underreporting of errors, and what is reported is the tip of the iceberg, which is very rightly stated that we don't see that reporting is either encouraged or even being seen as a practice. Many more errors happen in a day-to-day practice but do not get reported, often due to lack of awareness and even understanding of the nature of the mistakes, or ignorance, or a lack of system for reporting. Where a system is also being seen as a very important factor over here, where it doesn't encourages. Also, analyzing and providing feedback about the error. So many times it is being seen that there is a routine way where you have find that no one is being seen, nothing has to be worked on, there is no culture on improving it, so the reporting is being halted. Reporting of the error is the first step in the process of reducing the errors and the journey towards a continuous quality improvement. The success of the program depends upon how efficient the reporting system is. So as we have seen that the reporting system, if it is failure, it is always accepted that it has contributed actually to make the error happen. All efforts should be made to establish a blame-free and a non-punitive voluntary medication error reporting system. So you need to see that there should be a culture which should be evolved of a blame-free and a non-punitive, where there is no blame and there is no punishment which is to be given if though there is a reporting for a medication error. There is a staff sensitization which needs to be emphasized over here, and how staff sensitization is very much linked with error detection. In this figure of staff sensitization and medication error detection method, you may find on the right hand side that encouraging staff reporting, which is by speak up of safety. Self-report of medication error. The doctors, the nurses, paramedic staff should be encouraged and sensitized for self-reporting of the medication error. They need to have a culture of communicating it, discussing it, and also they need to be supported if they are ready for reporting it. I mean to say they should be encouraged for doing that. On the left hand side, you may see that the medication error detection methods can be seen that a patient's files for medication chart, doctor's order sheet, progress report, comparing medication administration record with the patient's physician's orders, discharge summaries, patient interview, directly observing medication administration and checking the intended and dispensed medication. So you may see that if you have a mechanism actually which is developed on identification or detecting, you can work on reducing the medication errors safely. Use of medication error data for improving patient safety. When you have a data, how you can work on and how it can really help actually to reduce this error, which can improve the patient safety. Just collecting data is not sufficient. Sufficient attention must be paid to find out the cause of the errors, to create a learning system and improve patient safety. Learning systems are one which are evolved out of the lessons or mistakes, and it helps actually that learning organization always sustain. All the efforts that the organization is making should be made to carry out a root cause analysis. A root cause to identify what and in what way the error has happened. Who is the one who is responsible for that and how it needs to improve. Categorizing the medication errors and the harm stratification. The harm is to be stratified with respect to what depth it has caused, what is the graveness of that, and in what long term it has affected to the patient. Even how it is being connected with the reputation of the hospital and the practices of the healthcare employee. The approach used is usually examining the critical incident analysis to identify the breaks in the patient safety management and why it broke down and contributing to the factors. So when you are getting the information from the RCA, that is a root cause analysis, and the team has identified or the quality managers have come across such incidences, they need to help in designing the interventions. The intervention should be for improving the system. The intervention should be for reducing the medication errors and also ensuring the medication safety, which it needs to be a practice and a growing culture of developing these habits. Disseminating the data to the stakeholders. The data needs to be discussed, developed actually, that there is a mechanism actually that the data should be disseminated to the stakeholders who are identified or who are a potential one who can cause the medication error. What is the data? The data can be the number of medication errors, the category of the medication errors, the error reaching to the patients and causing harm, which is impacting each of the stakeholders to be worked on and making it more clear that if they have to improve, they need to work on developing a system which gives them a clear data and a continuous data where they can see an on-site working for that. Why reporting of the medication error is important is emphasized in this figure over here, where you find that reporting is essential and it is very, very important. If at all a medication errors go unreported, what it causes? It causes no one a benefit. If we learn about the errors, we are a giant step closer to preventing them. So it is very important that if you learn about it, you can prevent it. You can work on even developing a system which can be identified as a best preventing system to reduce maximum reports on happening of medication errors. What can be done at a local level? At a local level, promote a culture of safety. What is the culture of safety? Identifying the existing failures and develop preventive measures to avoid the reoccurrence. So this is one a policy that needs to be developed in the institutions, which is to be identified as an institution which is working on a culture of safety. where the institution needs to develop actually each and every person who is in the healthcare system as an healthcare worker or hospital employee. They need to understand the responsibility of the culture that is existing, where they are working on the failures, they are developing on the preventive measures to avoid the reoccurrence of that. What is there to be taken as a responsibility at national level? A shared lessons which are to be seen, which to prevent the similar error events which are happening elsewhere, and learning from those lessons that what steps are taken, how they are reported, who is reporting, who are the people who are working on them, and in what way they have encountered a success for that. Along with that, developing a solution that require action at the national level. So actions are very important because it will make a sort of a lesson actually where when in what way actually the reporting can happen, and how importantly it deals with the major consequences will come from the actions for that. What are the common causes of medication error? There are certain common causes of medication error, and intervention strategies should be designed according to it. If you do come across a lot of the issues which are there for medication errors to happen, you can work according to you and read according to that, and you can design to correct them also. With respect to system and workflow factors, we can see heavy workload as contributing as a one and very important causes actually of causing the medication error. Lack of knowledge about the drug, heavy workload contributes as a second and third line cause for this. Poor documentation and transcription has been seen in addition to it. Non-standard time drug administration, preponderant time of drug administration, poor handling over and taking over, inadequately trained personnel, preparing a drug for multiple patients. This is also being seen as one very important factor for system and workflow. With respect to personal and drug specific factors, it can be attributed stating that inappropriate prescribing, lack of knowledge about the drug, poor communication, carelessness, look-alike and sound-alike LASA drugs, not taking history of the LASA drug, and inadequately trained personnel. These are very important causes actually which are contributing actually to the medication errors. Now, what are the steps in identification, collection and management of all the significant error that you can maximally work on? The step involves analyze each error to determine the root causes, which is a very important step that the team need to take or even the healthcare workers can be supported with. Compile a data about error frequencies and root causes. Share information to permit redesign of the system and the processes. Periodically assess the effectiveness of the risk reduction efforts. Proactive risk reduction by identification of the highest processes and failure modes, effects and critical analysis, that is FMEA. Where FMEA is one to be seen as a very important step actually to take in identification, collection and management of all the significant errors that are possibly to happen. Medication harm stratification. A national coordinating council for medication error reporting and prevention, that is NCCMERP, which classified medical errors by patient harm. A harm is defined as a impairment of the physical, emotional or psychological function or structure of the body and an or patient resulting therefrom. When you have to see this NCC MERP index for stratification of medication error, it can be seen as no harm, a circumstances or events with capacity to cause error, or an error related to harm where an error caused by temporary harm needed treatment intervention. Error caused temporary harm, initial prolonged hospitalization. or error caused permanent patient harm, or error resulted in near death or even death also as an event. Then comes error to death, or error which has resulted in a patient's death also, which can be a very serious concern. And lastly, a error with no harm also can be seen, where an error occurred but it did not reach to the patient. Error has reached the patient but no harm has occurred to the patient. Or error required increased monitoring but has not given any harm. So this is the stratification of the medication error, which is very clear over here. When you are working on the system or even in the organization, you are identifying this, you can work into this category. In the last to this chapter, I can say that monitoring patients after medication administration is very crucial to assess the desired effects and detect a delayed or immediate adverse drug reactions. Monitoring errors occur when providers fail to review the prescribed regimen, or they do not adequately track the patient's clinical or laboratory response, which is very important when you have to tackle this issue in a very dedicated way. What needs to understand is that reporting medication error is very essential, as unreported error hinder learning and prevention, which is very important. And when you are not learning from what has happened, it is hampering actually to develop a safer way. A strong reporting culture reduces future harm. If you have developed a culture after understanding and you have learned, you can understand how to report it. A strong reporting is very important to reduce the further harm for this. And lastly, the system level safety improvement requires both local actions, promoting a safety culture as well as identifying the failure. Along with promoting a safety culture, which is one very important to responsibly give and support, encourage, or even make it very clear that there will be no punitive action. And along with that, identifying the failures, which is even also giving them a data and even working on making responses actually to reduce this error. Also on preventing the reoccurrence. Additionally, along with the local action, there need to have a national actions. The national action that share the lessons which are learned and implemented broader solutions actually to prevent the similar incidents. If though there are some learnings actually which comes from the national level, gives the chances actually to the local bodies or organizations to work on and give a solution within right time. So with this, I come and end to this chapter. Thank you for listening. And here are some references actually which can help you to work on your projects for this. Thank you very much.